Good afternoon, everybody. My name is Susie Macri and I am the chair-elect of PARE, and I will be your moderator today for this webinar. Questions will be addressed at the end of the webinar. If you experience any technical difficulties, please contact again pare@eular.org. So, we have all lived some very weird times that caused us worry and anxiety. So we at PARE thought that it would be a good idea to organize a webinar with all these psychological effects that the pandemic had on us and have some experts talk to us about those and answer our questions. We were supposed to have Jeanette Andersen of Lupus Europe to talk to us about her personal experience, but unfortunately she's not feeling very well. So I'm going to read out to you her essay that was published in the eBreakthrough. How the COVID-19 pandemic impacts on my life as lupus patient. At the beginning of March, my husband Miguel got ill. He had a cough and sore throat, so we took the usual precautions we take when he gets sick. I stayed away from him. We slept into 2 different rooms and used 2 different bathrooms, and I cleaned and disinfected everything all the time. I suffer from lupus, and my treatments for this disease, like many other autoimmune diseases, consists of a lot of immunosuppressants, including biologic. This means that my body has difficulties defending itself against common diseases like the cold or the flu, and I can end up becoming severely sick, needing hospitalization if I catch one of them. After a couple of weeks, Miguel started getting sicker, combined with a high fever, and we called the doctor. From the symptoms displayed, he was fairly sure Miguel had caught COVID-19 and didn't want him to come into the clinic for fear that he would infect other patients. We asked if he should be tested, but the doctor said no, because the testing materials were extremely limited in Denmark at that time, and it was very difficult for us to travel to a testing site. As Miguel was sick and I was in the exposed group, neither of us could go outside our home for shopping or similar things. We had to arrange for one of our neighbors to go shopping for us, and I had to get my prescriptions filled by an online pharmacy. We also had to stay away from everyone, including each other, which was the worst thing. After avoiding catching whatever my husband had for 2 weeks, I started coughing too. At this point, we were very worried. We had to assume that we both had COVID-19 and isolate ourselves completely from society. When I also started having fevers, I consulted both my GP and the rheumatologist in charge of treating my lupus for advice. They told me to keep an eye on my temperature and continue taking my usual medication as long as it was not too high, about 39 degrees centigrade. The moment my fever got high, I should contact them immediately. Luckily, my fever did not exceed 39 degrees. After a couple of weeks of both of us being sick, it was possible to be tested for COVID-19, and Miguel was feeling well enough to drive us to the clinic. We were tested on a Thursday, and on Friday we got the results. Negative for SARS-CoV-2 with a possible false negative of 15%. When I asked the doctor about the false negative percentage being so high, he said that they normally had to test 3 times for it to be reliable, which means we were none the wiser about our diagnosis. At this point, we were both on the mend and our doctor did not think it was necessary to be tested again. During all of this, I could not get my physical therapy treatments, which I usually get 3 times a week. Physical therapy consists of an exercise in hot water session and 2 physical manipulation of the connective tissue and acupuncture treatments. This might seem trivial to some, but I'm deeply dependent on this treatment to keep me functioning. This means that my walking distance has been reduced drastically and my pain levels have increased enormously. As society shut down around us in the middle of March, I suddenly began hearing from ordinary, in inverted commas, ordinary healthy people who could relate to our normal situation of confinement and anxiousness. It is amazing how many things have been put into place since people have been confined and began working from home more. That is not possible for us generally. My worry is now that society is finally reopening. A lot of exposed patients like myself are being forced back out into an unsafe environment like our work or school or etc. I am lucky as I can self-isolate, but many others do not have that option. I still do not know for sure if we had COVID-19 or not, but I do know that my lupus has flared up afterwards and now I have a lot of difficulty getting it under control again. This is the essay of Jeanette Andersen and her experience with COVID-19 during the lockdown. We just wish Jeanette to be well soon and again to join us and be within the community of EULAR and PARE. Okay, now if you have any questions for Jeanette, we're happy to take them and send forward to them to her by mail, and if she can, she will answer. So, without any further ado, we move to our second speaker, Professor Jose Antonio da Silva. Thank you, Professor, for accepting our invitation and being here with us, who is going to talk to us about the psychological impacts of the COVID-19 pandemic and how to deal with them. Professor, the floor is yours.
Thank you. I hope that you can hear me now.
Yes, we can.
And I'm trying to share my video, my presentation with you. Well, thank you so much for inviting me to take part in this very important meeting. I hope that patients will benefit from it a lot, and also me as a professional to understand the concerns and the views of patients on this very specific times that we're living in and how it affects everybody. I have had for a long time, being a rheumatologist, a special interest in the psychological dimensions of rheumatic diseases. And this is for two main reasons. One of them is that I really believe that the way you feel in general about life and how your emotions are, it affects a lot the impact that any disease will have upon your quality of life. And on the other hand, there are also a variety of reasons to believe that stress and other emotional conditions can affect the immune system. And typically, all in all, although the evidence is, as always, a bit contradictory, stress, depression, and sadness tends to accelerate the immune response and autoimmune diseases, and also increase pain, whatever its origin, whereas harmony and, let's say, psychological well-being and happiness have been associated with a more balanced equilibrium of the immune system, therefore with improvements in a variety of conditions, including rheumatic diseases. And in order to address this issue, I will also make use of my experience in dealing and trying to help a lot of patients with a condition where stress is particularly important, which is fibromyalgia. And I've tried to understand better how this works and how best to try and help patients to deal with it. May I also call your attention that fibromyalgia is not a discrete disease that someone has and someone has not. It's more of a continuum. All of us are either a bit or a lot fibromyalgic. And actually fibromyalgia, which is characterized by generalized pain that tends to get worse under stress, is frequently associated with a variety of rheumatic conditions, namely rheumatoid arthritis, Sjogren's syndrome, lupus erythematosus, and therefore we are all prone to having our symptoms affected by our emotions, and there is no doubt that the COVID pandemic has been quite challenging on emotions. And in order to try and control the impact, I think, of course, we need to start with to acknowledge the problem, try to understand it, and then try to find ways on how to deal with it. And certainly the COVID has been very, very scary, namely because of the numbers that we all can see. As of 4th of July, more than 43,000 Portuguese had been declared as infected, over or very close to 3 million people in the USA, very close to 11 million people worldwide, and a very large number of dead people, 1,600 in Portugal, 132,000 in the USA, 530,000 worldwide. And it is especially worrying when you see that how fast this actually progressed. Like in this particular slide from very early on in the pandemic and how it evolved over the few months. And if you look at images like this being conveyed all the time by the media, no one will actually feel relaxed about it. And of course, everyone gets very, very worried, and only properly so. The issue then is, what can we do about it? You know, and because one thing that I frequently ask patients to consider is the obvious, that there is little use in worrying about things that we can't control. But somehow emotions, and particularly concerns, can become overwhelming and take control of our reasoning, our relationship with other people, and also our relationship with the disease itself. And it came to my mind while preparing this presentation, this sentence by Theodore Roosevelt, who said, you know, in the context of war, that the only thing we need to fear is fear itself. And I mean that there are a lot more things to fear than fear itself in the COVID, but there is no doubt in my mind that fear by itself can be a very, very important enemy. It can take over our reasoning about what we have, what we can do, and even about what we feel. So we should keep fear under very close control and not take of it more than absolutely needed. And I believe that, again, in trying to control the impact that these events can have upon each of us, it is useful to come back to the serenity prayer. Something that I love a lot was actually written by Reinhold Niebuhr, an American theologist who died in the 70s. And he said, "May God grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference." I frequently talk about this prayer as being the happiness prayer, because I do believe that if you can actually manage to achieve these, to be serene in things that you cannot change, acknowledge that, be at peace with them, and don't worry more than what is needed for you to do whatever you can do. If you have the courage, the energy, the health that you need to change the things that you can, and you can separate the two, you have a wonderful recipe there to, let's say, build a life that is worth living, and to control your anxiety about the enormous variety of events that take place every day, and COVID is just one of them. Well, what can we do then to try and acquire this wisdom, to build the required wisdom? Well, one of the most important things certainly is getting informed so that you understand exactly the dimension and the particularities of the problem that one is facing. What is COVID? How sizable is it? How risky is it? Is it special for me or not? And reflecting about this evidence so that you can come to terms with the problem in face. I do believe that communicating is extremely important in sharing responsibility, in sharing views, and finding ways around the difficulties and the challenges that we are facing. And it's only beautiful that this initiative by PARE is trying to give us all exactly these three things: information, an opportunity to reflect, and an opportunity to communicate and share. How can you reflect about this? Now, let me try and give you an alternative view of the data I just presented on the number of people infected or reported infected and the people dead by COVID-19 in the different countries. These were the numbers: 43,000 in Portugal, almost 3 million in the USA, 132,000 killed in the USA. But if you look at this from another perspective, perhaps you can feel a little bit more comfortable. Let me try and put this in animated form. I'm sorry. So that you can see that the proportion of people infected in each country and around the world is still not frightening, perhaps, as the absolute numbers would suggest. In Portugal, 1 in every 234 people have been infected so far. And so it means that on average, if I go out on the street and had everyone who had been infected until now still being contagious, I would have a probability of finding 1 person in every 234 who has the infection. Now, this is not to minimize, to say that there is no risk, but it takes, I think, a different perspective. 1 in every 391 in France, 1 in almost every 7,000 around the world. And if you're talking about the proportion of people who died is 1 per 6,000 in Portugal, very much more in the UK, 1 per 1,500, the USA 1 for 2,500, and around the world, as you see, 1 by more than 14,000 people. It gives you a different perspective, and it's hopefully can give you a view that the virus is not absolutely everywhere and that there is no absolute risk in every move that you make, that some and probably most of the measures that we are advised to take are good for us, are efficient, and should allow us to live reasonable lives even during this epidemic. Now, what fears can be brought about by a condition like this? Certainly, a fear of becoming ill is a very important one, like suggested by PARE themselves. Anxiety about going to the doctor, fear of job loss, depression from social distancing, and also what will the future look like? How will my condition and my life be after this COVID pandemic stops to exist or becomes under control? And I'll try to address each one of them. The fear of becoming ill can be composed, of course, of several dimensions, namely, does my disease put me at greater risk of being infected by COVID or having a serious infection by COVID? Does my treatment put me at a greater risk? And as a clinician, the second possibility here actually had me in great concern when this started, because as you all know, many of patients with rheumatic conditions are treated with immunosuppressive drugs, and these agents reduce the defense against infections. And therefore, it was to be expected that people exposed to immunosuppressants would have a greater risk of infection and a greater risk of more serious disease once they got infected. Fortunately, as time went by, we have now accumulated a lot of evidence. And this evidence that has been published in really speedy ways is quite reassuring, that there is no special risk associated not only with the rheumatic diseases in general, but also with the most apparently risky medications, namely the immunosuppressants. One of the most important publications is actually a result of a cooperation worldwide that was launched by EULAR. They have now accumulated data on more than 600 patients with rheumatic conditions, different treatments, different diseases that have been infected with COVID-19. And their final conclusions is that, one, there is no reason to conceive that patients with rheumatic diseases have an increased risk or increased frequency of infections, and only out of the many different medications that were studied, only high-dose glucocorticoids, prednisolone, was associated with the higher risk of people needing ventilation as opposed to not taking high-dose glucocorticoids. Even the most important and effective immunosuppressants like anti-TNF, anti-IL-6, anti-IL-1 have actually been associated with a reduced risk of serious infection because, as many of you probably know, many of the medications that we use in inflammatory rheumatic conditions have been shown to be useful in particularly severe cases of COVID-19 due to the control of the negative effects of the cytokines. That's what they do. Can my disease get out of control? Well, to tell you the truth, in thinking about the pathogenesis and the mechanisms, I think that this would be particularly a problem for patients whose condition is more affected by stress, like fibromyalgia. As I told you, many other patients have a fibromyalgia to higher or lower degree, and therefore stress itself can increase the symptoms. I would not expect that this stress would have a major impact in getting diseases such as SLE, rheumatoid arthritis, or Sjogren's or psoriatic arthritis out of control. It can actually increase somewhat the symptoms more than actually the inflammatory process itself, but it should not be a major effect at individual level, except if everyone gets so out of control that, for instance, medication is forgotten or other care about the disease is forgotten itself. Another issue is whether my disease or myself can be forgotten by doctors. And I certainly understand that while the pandemic is very active, many of the regular care for patients with chronic diseases is diminished in its intensity. And many patients may feel that they do not get the kind of care and the close attention than they used to, although I hope that almost everywhere in the world, patients will have at least benefited from phone calls or teleconferences and have not been too often disregarded by their doctors. Certainly, the worst, I believe, from this point of view, is already past, because even if more people are affected by the infection, we are a lot more experienced, and we all hope that the vaccination will be available by the end of this year. What about the fear of becoming ill itself? Again, what can I do? I can look for information. I can look for advice. On top of this webinar, for instance, in the EULAR website, you can find dedicated guidance to patients advising that they should not stop their medications without discussing this with their clinicians, that they should not take also other new medications without having this into account. But they were also advised not to stop even their immunosuppressants despite the conceivable risk associated with these agents, and this risk has not been confirmed, as I told you also. Anxiety about going to the doctor. There is no doubt that hospitals and clinical practices are risky places because many people can be accumulated there. People with the disease will tend to go to the hospital and to clinical practices, but I believe that particularly at least in the developed world, these trajectories of patients with suspected symptoms of COVID and other conditions in the hospital have been clearly separated. There is a tremendous number of practices, regulations in place. There are face masks everywhere, disinfectants everywhere, separate circuits for different patients. So really, I do believe that in the vast majority of cases, you should not avoid going to your doctor because you are afraid of the risk of COVID, especially not if you are feeling that your disease is getting out of control. You can always, I hope, try a phone call, get in touch, be sure of the security conditions that you have to visit your doctor and other health professionals that help you. Prevention measures are indeed effective, and I do believe that they are being taken care of in hospitals in the most appropriate way, so you should not be too fearful about visiting your doctor. Fear of job loss. I can understand that so many people have lost their jobs over the recent months, and of course no one can escape being afraid of this. The issue is, what can one do about it? If there is anything that you believe you can do to help that your working post will still be kept, so you're certainly welcome and advised to do that. But there are, of course, many areas of activity where the patient or the person, whether a patient or not, can do very little to avoid this. Although it is, of course, a problem, we need to consider whether it is something that is worth our worrying, whether we can do something about it or not, because worrying is only useful if there is something that you can do with the stress that you gather. Depression from social distancing is certainly frequently referred by patients. And it's not only depression, it's just a simple enjoyment of life. We obviously need each other. We need each other's company. We need each other's care. We need each other's look in the eyes. So being apart from the ones we love is certainly a reason for suffering. Many people, if they don't have the ability to take good care of themselves, are actually risking forgetting about their medications or other care if their beloved ones or their caregivers are not around. And this, of course, we all should be looking at and trying to make sure it does not happen. But we should try to keep mindful, in control of our feelings, understanding the feeling that we have, how natural it is, but trying to avoid that it takes over our ability to manage our emotions and relationship with our beloved ones, our next door neighbor, and with ourselves. We need to try our best to keep in control. And certainly communicating, being creative about that, using modern technologies like this one that allow us to chat and discuss common problems and concerns with people that are on the opposite side of the world, are certainly opportunities that we need to try and use. Although I also understand that some of these media, namely social media, can become quite poisonous. And so I would advise people to try and avoid very negative websites, very negative groups where people tend to enhance depression, concern, and fear more than actually good and calm and mindful reasoning. What will the future look like? Well, certainly many things will change. Many people believe that the world will not be the same ever again after this pandemic. I am sure that some of the good things can, on the other hand, be expected. Maybe we can value more than before the personal relationships we enjoy with each other, the ability and the need to help and to be assisted, to accept our fragilities and to help others. Also that we can hope that we'll be more mindful about the ecology, the change in the climate, the need and the ability that we have to control worldwide pollution. Maybe some patients will not need to travel every time to the doctor, because if their condition is stable, a phone call, a teleconference will allow them to receive all the help that they need. Well, thank you very much for listening. Keep safe and keep happy. Obrigado is the Portuguese word for that.
Thank you very much, Professor. Very interesting insight. We will now move, we'll take questions at the end. So we will now move to our next speaker, Wiek, who is the Vice President representing the Standing Committee of PARE by President EULAR, and who will talk to us about some easy tips on how to deal with this situation. And the title of his topic is What May Help Me? Dieter, the floor is yours.
I've been a patient since my age of 17, and for the last, when preparing this, I was aware that for the last, I think, 40 years, I went every summer into a rehab clinic. So I think I spent about 2 years of my life there in this rehab clinic, and it was always about self-management and so on. So one thing is that I referred to this material that I really experienced also in this clinic. Then another point is I contacted a psychologist working at a hospital in Berlin, who is also a member of the German League, and Cornelia Baltscheid. She provided some material. And definitely I also checked some things on the internet. I provided some material, and this is only an introduction what I'm telling now. That is, I provide some material so those who are interested, they can get that material, they can also translate it, they can share that. So this is just some kind of introduction to what is there as a PDF document. Next slide. I think we heard a lot about fears and wisdom and how to control things. One of the key things I believe is what you have to do all is that you're active, physically active, that you exercise. The top 3 pictures show what is now happening in our organization. That is, people are getting back to activities. This is, I think, what the individual has to decide, because there's a lot of material now in mass media about virus-laden droplets, about aerosol transmission. Perhaps this can be also another key question then afterwards, when there is some time for question and answers. So this is what I must say, what I personally would not do at the moment. To my mind, this risk is too high. But going outside, being active there in groups, having this kind of social distance, this is definitely great what we all can do. Next slide. I think a lot of these exercises, what we can do, this really depends on our health status. And I've just collected, I'd just like to show this picture here, where really small exercises all of us may be able to do. And the next slide then. There's a lot of material on YouTube. The point is, to my mind, that very often it is not for rheumatic patients or for those who really are seriously affected. Here I've got 2 examples from that I chose from YouTube. It is in German, but nowadays that you can change that and you can have English subtitles or subtitles in all other kinds of languages. The thing I like very much is that provided by NHS. It is not only about physical activity, but there are also lots of other things about mental well-being, for example. The point is, just as I said before, there are lots of things in there that I feel they are too difficult for patients that are really seriously affected by rheumatic disease or musculoskeletal disease. Next one. Based on my experience, and this is what I like very much, I think what is important that we do these breathing exercises, and they also lead to relaxation. There are some examples over here. My favorite comes from Anxiety Canada. There are lots of great things. When you do these exercises and you listen to these audio tapes for, let's say, breathing exercises, but also for other kinds of exercises, I'll come to that afterwards. The key problem is what I personally feel, it is the voice of the speaker, the kind of speaker you have. And I added here those WHO publications. They've got lots of fantastic material, but I must say I dislike that speaker. I can't relax with that kind of person. This is the key problem, but test it yourself. Find out yourself. Next one. So this is an exercise, and you'll find more exercises on that document, PDF document that we're going to share. Diana Rodriguez will share that with you. So I won't go into detail, but just an example. Next one. A thing I like very much, and I've also done that in that rehab clinic very, very often. It is Jacobson's progressive muscle relaxation. That is the idea. I think lots of you know that. It is this, you focus on tightening and relaxing specific muscle groups. And I think you really see that there is this difference of tension and then relaxation. And I feel this is a good way of also relaxing, and great material here, I feel, is on Anxiety Canada. Just try that. Next one. A thing I was not aware of totally, but it is also included in lots, or done also by lots of rehab clinics. It's body scan. It is a meditation exercise, comes from Asia, and it is the idea that you just wander through your body, that is from the feet to the head, and that you then are aware, but also you get rid of your thoughts, sensations, and feelings, and that there is some kind of accepting attitude afterwards. Great exercises are on living well, and you see the other one below. Next one. This is, I think, my favorite, but because there are lots of favorite places that I have encountered, and it's this visualizing my favorite place. Again, I won't go through how this is done, but just try that yourself, and the next slide as well. And you'll see that you can really feel comfortable, you feel great afterwards. And well, there are lots of, in that document that is available, there are also examples, then other examples, how you can do that. But there's also audio material available. Just try that, great, and also share that if you like. Last one. And this is, that's not the last one. Mandalas, I was not aware of that. This was provided by the psychologist I was talking about. It is pictures, it comes from the Sanskrit, that is from India, and you either then, you may also you paint these mandalas, but you also may just look at those things, and they may support also your thoughts, then also your relaxing. Next one. Well, this is my personal way of, I feel most. I just look into the camera, but I would prefer just changing now, moving into the other direction and watching the water, watching the mountains next to me, and at a greater distance. And this is a fantastic picture. It was before Corona. It was when I went to New Zealand. So I'd like to thank in particular Cornelia Baltscheid, because she provided some material, and also material that you are able to find then in that document. And thanks for listening, and hope you'll find useful to share that material or even translate if you like. Thanks.
Thank you, Dieter. Very interesting presentation with a lot of solutions that could help us to not just to deal with this weird situation, but also to deal generally with that in our life and how to cope with our problems that are always present in our lives. So we are ready now to take your questions. You can raise your hand if you want to talk, or you can ask a question in the chat. So I have a question for you, Professor. I was wondering, this societal impact of this pandemic, this thing that we had to keep distances and stay away from people and be isolated. Do you think that will create a more persistent social problem in the future? Will that leave us with this anxiety or worry that will lead us to avoid extensive social contact?
Well, I certainly am afraid that this may happen. And I'm particularly concerned about children because, let's say, these events may have a more lasting and profound impact upon them than actually among adults. As from the point of view of the adult people in general, I really don't know exactly what the consequences will be, but I do believe that many of us found that this social distancing to a certain extent brought us together. Let's say perhaps we had more time to call people we love or care about. Perhaps we had more time to do parties with our neighbors on the street, even if it was only to show in the social media. Certainly the information that has come through television and other media had made us more aware that we are all humans, that we're all fragile, that the virus crosses borders and crosses different classes of people, irrespective of their, their culture, their religion, their policies, or their wealth. And therefore, there is an opportunity for us to enhance our general sense of humanity and of shared care. But really, I also understand that many people may become afraid for a long time of infections and contamination, and this may have a negative effect upon them that persists even after the pandemic stops. I certainly hope not, but I'm not sure what will happen.
Yes, thank you. Dieter, you gave us some very interesting exercises. The body scan, visualizing your favorite space, and things that they generally have to do with meditation. Do you think that in order to have some beneficial effects, if we follow these exercises, does it take some time? Do we have to repeat many times in order to get the full benefit of it?
Well, I'll talk about myself. I think for me, it is like that I need some exercises. I must be outside in the and enjoy, let's say, the woods or whatever, wherever. So one of my favorites is definitely also that is cycling. Just find your way of, let's say, being active, either cycling or a Nordic walking or whatever, I think. And this is what you can also do with others. then I think these mental things, what I showed, this is what you can also do, for example, in between. I think, for example, when working for EULAR or with EULAR, you can also just sit there and do some breathing exercises, for example, for 5 or 10 minutes. That helps and also relaxes, I think. Yes.
Yes. Thank you. Yes.
I would like to ask a question.
Okay. Go on.
I would like to, or let's say a comment. So far, data show really that the risk of being infected with rheumatic disease and also taking medication for or against your rheumatic disease, these data show that the risk is not higher than average. But on the other hand, couldn't it be that these data are just average because people who have got that illness were very, very cautious, much more cautious than, let's say, the average. And that's why also that these data are so great, or seemingly so great. This is what I feel and my experience shows, because a lot of people were really scared of being infected, and therefore they were very self-isolated, they were very cautious, and so on.
I cannot say that you're not right. It's certainly a very plausible idea, the one that you bring. Maybe the results is just that people were careful enough. They were advised of the risks of their medications. Namely, most people with inflammatory rheumatic diseases that take immunosuppressants will have been, let's say, informed by their physicians that they had a higher risk of infection, that they should stop these medications if serious infection came about, as we usually do with biologic agents. So it's only to be expected that perhaps people who are in this group, and namely people with rheumatic diseases, have been extra careful, and this may have contributed to lower the risks. None of the studies that I have been able to look at until now have been able to put up, say, a control of how careful people were, and also of how, let's say, if they had a comparable group that was separated only by the disease. So your option still is, let's say, the hypothesis that you raise is still very plausible. May I, however, suggest to you that there is at least one item that seems to be reassuring and that we can put forward with confidence. Among those who have caught the disease, the rates of serious infection, namely admissions to hospitals, the need for ventilation, for instance, was not higher among these patients than among other groups of patients. So I would expect that the hypothesis you raise would reduce the total number of infections. Once you are infected, I would not expect that this plays an important role. And also these data seem to be reassuring. Thank you.
Thank you. Andri, would you like to ask your question to Dieter? You wrote it. Would you like
yes,
to?
I have
Okay. Go on.
I would like to ask if PARE could take videos like those that Dieter talked about, and also videos for physical activities from all PARE member organizations, and make translation, because many of them are on local language and it's difficult for the various organizations to translate. So could PARE take them and translated them and then share them to us, to the member organizations?
Andre, we really dealt with this question, and at the moment we are, I think, collecting what is possible. We have to be aware once more that it is really available in different languages. I showed this example of the German League, where we only have, or we have the chance of having these subtitles in different languages. This is not ideal, but we have got this COVID group now that Susie is leading, and we are trying to imagine then and see what is possible, because we need a budget for that, and we'll reflect on that, and we'll definitely let you know what is possible, what are we thinking of.
Yes, if I can add to that, we have had some very interesting ideas from all of you from the standing committee meeting. So we're planning to start working on that group very soon, and we'll come back to you when we have something ready to show. There's another question here from Ricardo. Hello, Ricardo. And how should healthcare services prepare for the likely higher demand of psychological care nowadays and in the next months and years? That's a very interesting question that puts pressure on social care systems. So, Professor.
Well, there is no easy answer that I can find. Certainly, I think organizations like PARE, the EULAR, the national leagues have a role to play on that. It is difficult, in my view, to be absolutely sure how much this affects, on average, everyone around. So one of my favorite, let's say, initiatives would be to have helplines with the assistance of experienced patient partners, of psychologists that could provide assistance on demand to people who really feel that they have this need. Apart from that, in my view, we should be made ourselves available in the same way as PARE is doing right now. But I'm also afraid that if we can overdo these things, talking so much about how much impact this may have, can frequently lead to an overexpression of concern. And sometimes I am afraid that, similar to what has happened with the media in general regarding the pandemic until now, it can also do some harm, because people can even become concerned about saying, why don't I feel all that? There's something wrong about me, because so many people are worried. It seems to be a catastrophe. And I don't think that we should overplay that. Be aware, offer sensible support, particularly among patients themselves, with the help of professionals where needed. But I don't think that a mega operation should be launched looking at these negative effects at the risk of actually enhancing them, from my point of view. But it's a personal perspective. Mm-hmm. I don't have a proper and secure answer for that.
Okay, thank you. I have another question from Hugo. Hello, Hugo. How can we help people to find the boundary between a safe behavior and the fear to go back to the lifestyle we lived before the pandemic?
Oh, well, very difficult question, I understand. My view is that, let's say, people need to be aware of the risks. The risks are considerable. This is a serious virus. It's not a very killer virus, so there has been much worse than this is. For most people, the infection is fortunately not that severe, but we all need to be aware that in specific circumstances, namely in the elderly, in people with multiple disease conditions, in the obese and the smokers, it can be much more serious. So people need to be aware, I think, of the pandemic in general, of their own special risk group if they are in one, and then make their choices. There are certainly behaviors that would be completely irresponsible today, like we are seeing in Portugal and elsewhere, particularly young people going to parties in their hundreds or even in their thousands, wearing no face masks, having no, let's say, care whatsoever to prevent infection. On the opposite, it would be a condition where people are so scared that they don't socialize even among their families. I know of people in Portugal in this moment that still do not share the table with their families at meals because they are worried, because if someone goes out and may bring the infection home. People are still careful to the point of getting rid of all their clothes before entering home if they went out to work. To what extent should you go? It's very difficult to say because it's actually a very, let's say, subjective measure of risks versus benefit. On one side, if you take the risks too seriously, you stop living almost immediately and almost completely. If you don't care at all, you are risking to have some infection. I think that adhering to the general practice of keeping your social distancing, wearing a facial mask, disinfecting and washing your hands carefully, of course, being aware of any people who may represent a risk of contagion is, I think, balanced enough, and that already allows for a reasonable quality of life, not the way it was before. That I think we'll have to wait for another year or so.
It's a question for both of you. Do you think that this isolation for all of us, for personally to each of us, have we received some lessons about it? Have we learned some things about having time with ourselves, finding time to do things for ourselves, maybe listening to our hearts and to our souls? Do you think that happened?
Dieter, what is your view?
Dieter, you go first.
Well, what I personally feel is that when this pandemic really started, at least what I can observe here in Germany, when the pandemic started, people were cautious, but also their habits, their behavior partly changed. They were more friendly, they kept a distance, but when I walked here around my house, people greeted, they never did. I don't know what it was like. Yeah, what it was like. But this then, after some time now, this changed. And we see also that there are what I would like to call even outbursts. I think, as you said before, that now you see people gathering, having parties suddenly when the weather is good. And also the people changed. And well, my habit, I think, personally has not changed. I'm not very different from before Corona, so I can't say. And but on the other hand, I must say also I'm quite privileged to where I live, how I live. So I'm definitely not belong to those average people, because lots of people, this is what we have to see, they have great problems. They have a family with several kids living in an apartment, no way of getting out easily, and their lives really changed, I think. And also some elderly people, I think they really had problems depending on their life circumstances.
Well, in my view, it has been obviously very tough on many people.
Yeah.
And I especially am, let's say, I feel about the elderly and the people who lost their jobs. I think this can be extremely hard, particularly in some societies where people don't have other ways of living or sustaining themselves. Let's say if you're working in a rural area, you can at least avoid hunger, but in big towns, it's much harder. It's much harder to do. Certainly also many people lost their beloved ones, be they younger or older. and they were frightened by the disease if several members of the family were affected, or even if only one was very severely affected. If I try to look on the positive side, like Dita just referred to, that people who were greeting each other more, it's quite interesting to see that. And I think it gives us a very good opportunity to show how moments of challenging moments bring us together. We had a number of occasions like that in Portugal over recent years, be when we had our revolution, for instance, in '74, already a long time ago, but recently when we got together in fighting for the freedom of people from East Timor, because it was an old Portuguese province. How fantastic a feeling it was that you suddenly feel, let's say, a member of humanity. You certainly feel that you share these vulnerabilities and that you want to hold each other, and you recognize that. Unfortunately, I am afraid that we are rather fast also at forgetting that. When we go back to our old lives, or when we are, let's say, seized with the idea of getting our freedom back again and forgetting about our next door neighbor. But certainly there are a lot of opportunities for us to learn, to go back to basics, to really important thing. Look what we did for pollution. It's absolutely amazing, isn't it? You know, all of a sudden, we saw that we could actually save the planet if we were willing to make the let's say, the requests and the suffering that it of course needs, and the efforts that it requires. So there's a lot to be learned. I hope that we will keep that in mind for quite a while, and that people like PARE will contribute for us not forgetting it too fast.
Dieter, you and your organization have done quite a lot of things to support the patients. Would you give us some examples of what you have done to support your patients?
I do not know whether we are extraordinary, but I think the first thing is what I saw on one of the slides of Professor Silva. First thing is being informed. And this is one of the key things we all have to do is, and that this kind of information, that it is evidence-based, that it is really together done with, let's say, the Scientific Society for Rheumatology, for example. This is one of the key things, that is updating that information. Another thing is that we really offer helplines, and now we are running the third helpline at the moment, and we see that patients have got rather specific questions with reference to their specific medication, for example. And this is rather important, that a specialist, a rheumatologist, then answers these questions. So a lot has got to do with information, offering helplines, and what we also see, that this kind of helpline then enables that patients again who had questions, that again after that they exchange their views, what they experience. So it is also an instrument of enabling discussions, I think, among those people. And this is what we have to offer, that is informing, but also giving a platform for discussions, for debates. And this also, I think, then takes away very often the risk then that people get away from their concerns, that they lose their worries, I think.
Yeah. Thank you.
If I may,
of course.
I think that one of the most important things is trying to avoid that people make decisions by comparing their disease or the benefits of their medications with fear, as opposed to comparing risk and benefit. There is a risk there. But when people allow themselves, or the conditions, let's say, make them be overwhelmed by fear, good reasoning goes out the door. And so we need to make a balance of how many people, what is the actual risk, 1 in 100, 1 in 200, how much do I value that? And how much do I value my life? How much do I value my medication, my exercise, for instance, right? And this is what we need to balance. Fear is a bad advisor.
Yes.
And so in addition,
yes.
these exercises on well-being, it's a pity, but it's just available in German. There is this app that I recommended, but for German speakers, for Austrian, for Swiss people, it may be also available then. Yeah.
Yeah, good, thank you. And Nele, are you here? You share also a link? It's on what? If you can say a few words. Hi.
Yeah. Hi everyone.
Hello, Nele.
Hi.
Just to say, I will remember to give you a big hug, Professor, when I see you again.
I want a hug too.
It's a pleasure.
In the chat, I shared a link with you to the website of Lupus Europe. They have made an exercise program. It's not specifically for the corona pandemic, but just an exercise that you can do all the time. And it comes from Lupus Europe, but I think it's also possible to do the exercises with other rheumatic diseases. So that's why I shared it. It's very simple and it's different stages. So just have a look at the videos.
Thank you.
Great.
Professor, you said something about the environment before, that this maybe has made us more cautious for the environment. And I feel it's true, because if I speak out of my own experience, I mean, I had to stay at home, and I was at the beginning when I heard that, okay, you have to stay at home for 20 days, and then it was 30, and then it was 40. At the beginning, when it was only 15 days, I thought, oh my God, how am I going to do that? And then the 15 days passed really quickly. And then the 2 months passed really quickly, and I just got out of the house only 3 times to visit the doctor and get my medicine. And I did find things to do at home. I did many things. I was buying books on Amazon and reading them on my Kindle. I did many things at home. I came with everything I had to do up to date. And then when I was allowed to move out, now I think twice before I go out. If it's not absolutely necessary, I don't go out. I just gather the things that I want to do on one day and go out and do everything. So that's good for the environment. And that's my personal experience. So that whole experience must have done something inside us to change us for better, I think.
Yeah, there was in Portugal, as everywhere, people try to make some jokes going around this, make it easier. One of them was referring that this man after staying 15 days at home, he had discovered how nice a person his wife was. And let's say this is something we may have discovered, right? The enjoyment of being with our own people, of being with our own curios, our books, our entertainings, and how life can still be enjoyable despite being made so much simpler by this pandemic. How, for instance, it became so much easier for us to share ideas and to share concerns through, for instance, teleconferencing, as opposed to what we thought before. So if we use this, we can actually, let's say, come out more sensible and wise than we came in.
Okay, yeah. And I have another question to you. This doesn't concern the psychological effect, but once we have you here, I'm tempted to ask that. I was hearing on the news the other day that this pandemic has not caused any more deaths than a common flu. Is that true?
Well, let's say if you take in absolute numbers, and now it's no longer true, I believe, nor in Portugal nor in elsewhere. But it is true that, let's say, you see, for instance, that now in Portugal we have 1,600 dead people from COVID. And on a regular basis, we have about 1,300 to 1,400 people dying from regular flu every year. So, of course, we're still not over the pandemic, but it's really good to keep this into perspective. You see, not long ago on the news, I said that we are so worried about 1,600 people, and properly so, but this is about the same number of the people who die in Portugal every year from a hip fracture, from osteoporosis alone, you see? Yeah. And typically also the elderly people. So this is when I was making these comments on being informed, keeping things in perspective and not allowing absolute numbers and the media to take over our reasoning capacity. It can be too much. But if you take into perspective, you say, well, we have lived with the flu for a long, long time. We have lived with osteoporosis for a long, long time, right? So this is here. This is new, this is adding on top of everything else, but it's still not, let's say, the end of the world, I'd say.
Thank you. So do you have, both of you, Dieter and Professor, we're arrived to the end. Do you have a message to convey to our patients? Dieter.
Well, my key message is, I think, what we heard before, that you really have to see the risks, I think. And if I refer to what Hugo said, I think you must develop yourself, where is the boundary? And if you take these precautions, what we all know, I think, then definitely you have a chance of returning to life, not as normal, but I think so that you socialize again, that you can be together with others, because we must be aware this kind of pandemic will torture us perhaps otherwise for months, I think, because we can be sure, quite sure, there is not the medication, number one, and we will not have vaccines in the following months. And if there are some, then definitely who will be able to get these vaccines? This is another point. Yeah. So I think we must get accustomed to this kind of life, and we must, let's say, be aware then how we can handle all this, and so that we can somehow return at least to some kind of life we have had before.
Thank you. Professor, your message?
Yeah, my message is that, let's try and use the opportunity that the pandemic gives us to really come closer to what is really important for us. How much this has affected, our relationships with each other, and what opportunities did this highlight as being core for our happiness in the future. In my view, and I use that as a guiding vision for my own department, everything should be tried to be translated into happiness for each other, for the ones that surround us, for around the world. Health is certainly a contribution to that, but it's not the only thing that matters. The quality of our living, of our interactions, is certainly more important than health only. And if we come to grasp with that, we make a reasonable weighing and balancing between the risks and the benefits, we can actually come out of the pandemic with a higher quality of life, with more meaning than we had before. Let's hope that we are all wise enough to see that.
Thank you very much. Thank you very much both for your contributions
you.
and for this very nice discussion. Thank you to all for having participated at this webinar. I'll just read here a comment from Uko. I think we live the mix of good and bad experiences, and we have to learn something from both. That's very true. Thank you very much. Have a nice evening. And we'll have our next webinar also on the 9th, a later time for all the people that couldn't join us today. Have a nice evening.
Bye.
Goodbye.
Bye.
Goodbye.